is J. Loredo and I will be collecting your blood today. I will explain the procedure while we are doing it, but before we proceed, I will need you to identify your name and date of birth to verify it using the requisition form. Okay, Mr. Lakatan, let's proceed. I will just position your arm so that you feel more comfortable, and then I'll just prepare my equipment so that it is within my reach. Okay, now I'll apply the tourniquet around your arm. Tell me if it hurts, Mr. Lakatan. Okay, good. Next, I'll palpate for a vein using 2 fingers and then select the desired vein to collect blood. After selecting, I will remove the tourniquet, mark the site, and then clean it with isopropyl alcohol. I will clean it in a circular motion moving outward, then disposing it afterwards. While waiting for the alcohol to dry, I'll prepare the equipment. Then I'll reapply the tourniquet around the arm, then proceed to the actual blood collection. I'll get my needle ready, removing the needle safety cap, and then inspecting the syringe. Okay, then I'll proceed with anchoring the vein 2 centimeters below the site of entry using the tongue, and then pulling the skin downward. Then I'll insert the syringe into the vein smoothly at a 15 to 30 degree angle. Next, I'll be obtaining the blood by careful aspiration and allow the blood to fill completely. After filling it, I'll remove the tourniquet, place a cotton on top of the site before withdrawing the needle. Okay, Mr. Lakatan, can you kindly please hold the cotton? And I will transfer the blood to the evacuated tubes by inserting it into the stopper. Then I will invert it 8 to 10 times. And then I will pick up the needle and then dispose it in the waste into proper bins. I will then label the tubes to be used in test, then discard the waste in proper containers. Lastly, I will now check your arm to make sure that the clotting has occurred. Then, apply tape. And you are ready to leave now, Mr. Lakatan. Thank you very much. my name is Jado Laredo and I will be collecting your blood today. So I will explain the process while doing it, but before we proceed, I will need you to identify yourself and your date of birth. Okay, Mr. Lakatan, let's proceed. I will just move your arm so that you'll be more comfortable. Then I'll prepare my equipment so that it is within my reach. Okay, now I'll apply the tourniquet. Tell me if it hurts, Mr. Lakatan. Okay, good. Next, I'll palpate for a vein using 2 fingers. Then, select the desired vein to collect blood. After selecting, I will remove the tourniquet, mark the site, and then clean it with isopropyl alcohol. I'll clean the site using a circular motion moving outward. Then disposing it afterwards. While waiting for the alcohol to dry, I'll assemble the equipment. That I will reapply the tourniquet. Then, proceeding to the actual blood collection, I will get my needle ready. Moving the safety cap and then inspecting the syringe. Using my non-dominant hand, I will anchor the vein using the thumb and the index finger, pulling the skin downward. Then, I will insert the needle into the vein, bevel up, and at a 15 to 30 degree angle. Next, I'll get my tube and push it onto the needle without moving the holder. Allow it to fill completely. After filling it, I remove the tube. Then, I will invert the tubes 8 to 10 times. Set it aside for now. And I'll remove the tourniquet. Place a cotton on top of the site before withdrawing the needle. Then I'll ask you, Mr. Lakatan, to please kindly hold the cotton with pressure. The needle, after using it, I will dispose it into the proper bins. Then, next I will label the tubes to be used in test. Lastly, I will inspect the wound, the puncture wound, and then apply bandage if necessary. Okay, Mr. Lakatan, you may now leave. Next, I will dispose of the other waste. And the blood collection is now finished.